That's a great question. And in speaking from my facility's standpoint, when you basically get your diagnosis, with that diagnosis comes a team of providers that are aimed at kind of treating your disease holistically. So you have your medical providers, which is comprised of physicians, nurse practitioners, and physician assistants. There is a social worker who also provides psychosocial support. So they connect you with financial support as well as psychosocial support. And typically you have a coordinator who's a lot of times your point of contact in your journey as you're kind of going through these multiple lines of therapy. And so I just encourage you to just keep asking your providers, what other assistance do we have available at your clinic, and how can that benefit you? Because I think sometimes we get hyper-focused on treatment of your disease, and it's easy to kind of overlook those other areas, which are all very important: psychosocial support, financial support. In addition to your medical team, after your diagnosis, you're going to have an outpouring of support from your community. And we all tend to be pretty humble and not always wanting to accept that support. And I encourage everyone to basically reach out to that support system and allow them to help you. And so, it's easy to say, well, I'm okay, I'll figure it out. But if they're there offering help, they want to be helpful, they want to be part of it, and and allow them to do so, and that'll take some of that strain off of you. So for me, the mental health aspect of this starts from the moment you are diagnosed. And so these diagnoses are extremely distressing. Any cancer diagnosis is a cause for anxiety and depression. And yes, it's not all going to be sunshine and rainbows as we go through it. And I want people to truly understand that it's okay to not feel amazing about this all the time, because this is extremely, like we said, distressing and difficult to go through. And so with that being said, I just say, it's kind of up to each person of what is that warning or that trigger. But the general rule of thumb is kind of, feelings of depression, feelings of self-harm, feelings of not interested in what you were previously interested in before, extreme fatigue, labile mood, so you're extremely happy one minute, you're extremely sad the next minute, or you're just quick to go off on people that are helping you through this. And so my recommendation is always, as soon as you get your diagnosis, is to reach out to your network, find your support options. And we're in a great time in the post-COVID years of being able to access mental health professionals online and through apps. And I just say, get in touch with somebody right away. The other concern I also have voiced to me all the time is patients are not sure if they should be on medication or not. So I say, open the door for that conversation with your medical providers. And it's not a bad idea to look into medication options while you're going through treatments and stuff like that, and just see if it's something that would benefit you. And I also reinforce that if you start an antidepressant medication or anti-anxiety medication, that it doesn't mean that you're going to be on that for the rest of your life. A lot of times we just use that as a tool to get you through the more distressing aspects of your treatment. And then as you recover, we can look at removing that if we feel like it's appropriate. But I just say, just know your body, and it's okay to not feel happy. But if you're noticing that you're really struggling and you're feeling sad and down and depression and anxious, that there's a ton of resources available, and don't be afraid to seek those out. I actually love this question. This is a big passion of mine. Is so palliative care and hospice are actually they're related services, but two very different services. Palliative care is focused on what we call the palliation of symptoms. So that is the treatment of severe symptoms as you go through your treatment, where hospice is specifically geared towards basically palliation of symptoms, but without the intent to cure any problem. And so hospice is end of life, where palliative is something that I personally think should start from the day that you walk into your cancer treatments, or from the date of your diagnosis, really. You should be thinking in terms of connecting with a palliative provider. Palliative will essentially look at your pain control, your nausea control, your emotional health, and they have resources to be able to plug you into different programs. It could be medication support, it could be emotional support, and it's what I also love about palliative. It's a focus on the patient as a whole, and when I say patient as a whole, that also means the patient, their family and friends, and your support group also can a lot of times receive support services from these palliative groups. And so for me, I think any person with a cancer diagnosis should also be seeking out palliative care. As you go through your treatments, if you're having significant side effects, then palliative is even more indicated because your medical providers may be, trying to do the best that they can, but they might not. Their focus is on treating cancer, not always resolution of symptoms. And so that's where a palliative provider can really be beneficial. Is really just focus on pain, nausea, and then emotional or suffering, and help to alleviate those symptoms.